Ladies and gentlemen, how you doing tonight?
Great now.
Okay, welcome to Accuracy in Academia's Healthcare Summit. That is in a way what it is. That is in a way what it is. Because what we try to do is to bring you the authors you're not going to get on college campuses or, for that matter, in congressional hearings, who might actually know something about the subject. And this is a very special one because we're also featuring a book, our first textbook, a nice, easily read little compendium here called Voodoo Anyone, How to Understand Economics Without Really Trying. It's so easy John McCain can understand it. Anyway. I couldn't resist. Anyway, the author, well qualified to talk on the subject, and yes, they cover healthcare, they cover everything we're dealing with now. And the author was the former editorial page editor of Investor's Business Daily, who then went on to become a tenured professor of journalism at Troy University in Alabama, Christopher T. Warden. Very tragically, we lost him, but his mentor and friend, and a mentor and friend to a lot of us, Stanton Evans, has graciously agreed to do remarks in connection with this book. I highly recommend it. We're discounting it tonight. It's usually $9.95. This is going tonight for $5. And at 100 pages, it's 1,900 pages less than the healthcare bill, but only 900 pages less than the more conservative Republican alternative. Now, I give you, without further ado, the man who actually inspired the book with his economics lectures, veteran journalist, fast becoming one of our preeminent historians as well, Stanton Evans.
Thank you very much, Malcolm, and thank all of you. It's a very fine crowd here. I'd like to know more about you. So I want to, each and every one of you stand up, give me your name, astrological sign, where you work, where you school. So I would like to know how many of you are like perhaps Hill interns working in congressional offices? It's a joke, and I'm guessing maybe that you're in Republican offices. Am I right about that? Mostly, maybe more conservative type folk. I asked that because this book by Chris Warden was really written as a primer for journalists to cover issues here in Washington and elsewhere, because some of them involve economics, and it's also a book that could be read to great benefit by maybe some folks across the street there in dealing with some of the issues that confront us politically today. Now, I know that if you're like me, when you look at all these complicated issues that are out there, healthcare being number one right now, but cap and trade and the collapse of the stock market now rebounding a little bit, and the whole housing implosion and collapse of the financial industry and the automotive industry, and on it goes. And when I see these highly complicated technical economic issues in the news, I ask myself, and perhaps you do the same, when I'm confused by these matters, what do rock stars think about this? Does that occur to you to ask that question? Because that's what we generally get in terms of analysis and solutions to these problems. Are you familiar with the work of Bono, U2, I used to call it Bono, but it's Bono, isn't it? It's really Bono, not Bono. And as you know, he's kind of a universal expert on these matters. And is highly respected by the media. And I read a thing about Bono, in the Washingtonian magazine a few years ago. Said it was some kind of meeting with the Treasury Secretary and congressmen and senators and other people from Washington discussing global warming. Of course, we've experienced a lot of that recently, and other complicated issues. And the article in the Washingtonian said, and Bono was the most intelligent person in the room. And I believe that. That is perfectly plausible. On the other hand, Bono, and by the way, I liked him a lot better when he was with Cher. You remember that? You're a little young to remember that. But anyway, as good as he is, he can't always be here for us. He has many obligations. He's probably in Africa right now dealing with problems over there. So that's why we need this book, something to help us when he isn't here. And I guess that's the most important thing I can say about it. There are a number of things involved in this book and in economic subjects generally that resolve themselves into a few secret formulae. In fact, there's one main secret to understand in this welter of issues. If you understand this one secret thing, you understand almost everything. If you don't understand this secret thing, you don't understand anything. From which it would seem that it's kind of important to know what this secret is, right? I mean, that seems to follow in my thinking. If you would like to know what this secret is, I hope that you will buy my tapes, which I'll be selling at the door as you leave. 1995. Not available in stores. I don't know, well, why are these things not available in stores? What is there about these items that you can't get them in stores? But that's true of my tapes also. And you will know what the secret is. That's all a lie. There is no tapes, and there's no secret. There is a fundamental concept that you need to understand to be able to deal with healthcare issues, with energy issues, with housing, with financial issues, anything you want to deal with politically or journalistically. And if you understand this, you can comprehend the issues, and if not, you don't. The difficulty is that journalists, by and large, do not understand this or anything else about economics. Most journalists, and I was one myself for many, many years, have no training in economics. They don't want to have any training in economics. They became English majors or journalism majors to get away from things like economics. And so it's all a big mystery to them. It's just, they're totally clueless as to what's going on. This book was written to deal with that kind of problem. And I might say, again, the same observations apply to our friends across the street. The one thing that you need to understand, all of us need to understand, to solve some of these riddles is prices, the function of prices. And let me ask you another question. How many of you have had any econ? You don't count, Preston. You're a ringer.
Being honest.
Okay, all right. Good. It's good if you had some. Maybe it depends on where you had the econ at, as we say in Alabama. And it might be better if you didn't have the wrong kind of economics. But if you got some concept and you know what prices are very crucial to understanding the way the world works. And a very simple example, and Chris Warden has a number of these examples in his book, would be healthcare or energy prices. And again, this is many, many years ago, but back in the day, as we say, we had price controls on gasoline. Price controls, because Why, Malcolm? Because energy is too important to be left to the market. So let's get some controls on it.
Finite resource.
Exactly. And they did. So that you then had a crisis. There was no gas. And our offices then at the National Journalism Center were over on the other side of the hill, over Roland's. Are you familiar with that strip there on Pennsylvania Avenue? Hawk and Dove and the different restaurants and bars. I know none of you go to bars, but restaurants over there. And you should not go to bars unless you're of age. And didn't mean to suggest otherwise. And our offices were right over Roland's grocery store, and there's a gas station there at the corner of 4th and Penn Southeast. And so I remember holding a seminar there and looking at the window, and the gas station had only so much gas, and lines went all the way around the block, all the way up to 3rd Street, and God knows how far back from there. And that night I went home and turned on my TV news, and there was a report about these gas lines that were built up. This is 1979, mind you. And a reporter was there interviewing a motorist in the gas line, and interviewed several of them, and said, the interviewer went like this: well, how long have you been sitting in this gas line? I've been here about an hour and a half. Okay, how do you feel about this? I'm mad as hell. Okay, what do you think is going on here? Why is this gas line here? Well, my brother-in-law talked to somebody who said that the oil companies are conspiring against us, and these tankers are sitting offshore withholding gas in the market, and that's what's going on here. Well, thank you very much, sir. Back to you, Dan. That's the report. Clueless. This is not only not accurate, this is disinformation. The reason the gas lines were there is because the government held the price of petroleum and gasoline at the pump below its market level. When you do that, you do two things. With any product, you encourage the demand for it because people will take more of it at the low price, and you discourage the production of it because people can't make any money producing it. Duh. And so there's a shortage. And any time you see the word shortage, and we used to teach this to our students at the NJC, take a look at the pricing mechanism, and you will invariably see that where there is a shortage, somebody, some government, federal generally, has held the price of the product below its market level. That's where shortages come from. More demand, less supply. Turn that around. Raise prices way above their market level and require a certain minimum price to be charged for something such as farm commodities, and you pay the producer of it to produce it. If the price doesn't reach that in the market, you give them a subsidy. When you do that, you discourage consumption because the price is inordinately high, and you encourage more production. When you do that, you get a surplus. The exact opposite of the price that's below the market level. That's the way it works. This is not rocket science. It's common sense. Now, if you look at our healthcare problem, and I did a radio interview today about this, and about this very fine book. Chris Warden discusses all of these things in this book. We have a situation in which the healthcare economy is consuming more and more and more of our resources. Why is this? Why is it we have these runaway costs, we have this expanding sector of healthcare spending, we have all kinds of problems in terms of the Medicare and Medicaid programs, private health insurance, premiums going through the roof, taxes going through the roof. Why is this? Nobody knows. They're just totally confused. It's just impossible to understand. Well, it's not if you know the econ. Our healthcare economy is based on now something called third-party payment, which means that somebody other than the patient is paying for most of the health care they receive. So that if you want to get health care in our day and age, you go to the doctor or the hospital and you sign some kind of form, and the bill is sent to somebody else to pay, by and large. And not all of it, co-pays and so on. But the vast bulk of it is. Well, in that event, what do you care how much it costs? You don't really. It's a valued resource, it's a valued service, so that, yeah, well, okay, yeah, I'm signing here, give me the health care. This is another question of price. The perceived price by the consumer is very, very low compared to the value of the service. And this is now pervasive in our economy. The way we finance almost all health care is through so-called insurance, although it's not really insurance, that's another issue. And for a long time, they've changed this recently. They thought, what can we do? What else could we do to screw this up royally? And so I've got it. I know what we could do. We could reimburse the providers according to their costs. Yeah, that makes a lot of sense. So that, therefore, in order to get more money, you get more and more expensive health care, and then you get reimbursed because you spent more money. Brilliant. So that you're then charging the consumer a very low price and then rewarding the person supplying it, which is different in this respect, with a guaranteed profit. And we wonder why. Gee, why is this stuff going through the roof? I don't know. Gee, I'm just totally confused. That's what's going on here. Third-party payment is what is driving the system. There are other problems too, but that's the engine that drives the whole thing. It's been going on for about 40 or 50 years, and it's getting worse all the time. This is what brings on rationing. If we financed anything else as we do health care, you would have very similar problems. Suppose that you came to this pizzeria for lunch every day, or any restaurant along here, and you just could go into the restaurant and order anything you wanted, and then sign a check for it, and the bill is sent to someplace else to be paid, not by you. Well, gee, that would be good. I would like that. And so I would then, maybe I wouldn't be eating pizza. I might be eating, sirloin steak for lunch, and maybe lobster, or maybe bring me a couple of splits of champagne over here, waiter, and we'll sign that and send that check to somebody else to pay the bill. If we did that, if we financed lunch, the way we finance healthcare, we would very rapidly develop a lunch crisis. Lunch, we would have to have a whole series of task forces to study lunch. What is wrong with lunch that is costing so much? What is going on here with lunch? And so then you would have, they'd be legislating over there, they'd be having a summit in Blair House, and the president, we got to, all of us work together on lunch to figure out how we can have a more rational lunch program in this country, because we cannot continue. This is unsustainable lunch. So that anything else would be the same problem. It ain't that complicated if you know anything about anything. That's in this book. Read this book. But they haven't read this book. Now, Senator Enzi has read the book. Good for him. He's quoting from it. Bless him. Barack Obama has not read this book. Nor have a bunch of other people who were down there at this big old summit conference. God knows what they've come up with. What I fear is the stuff that they will be able to agree on. Fear that. If they agree on it, you know it's wrong. Absolutely. And we can go into that if you wish, but I skip over that now. The main thing that they're all proposing, President Obama and people in Congress, including some of maybe the people you work for, I won't know any names, to deal with a problem created by third-party payment. We need more third-party payment. That's what we need, more. Do more of this. Yeah, that's the ticket. Yeah. So that's what they're doing. We're going to do more of this. And so we got, like, just concepts that are unbelievable. Almost said expletive deleted there. I control that for a moment. My favorite is they're agreed. Republicans too, by the way. We need to insure for pre-existing conditions. Pre-existing conditions. Now think about that. You know, you're already sick, but we're going to make the insurance companies insured for that. Well, how do you insure for something that's already happened? I don't know if you've studied the insurance industry very much, but the whole idea of insurance is that you insure on something that might or might not happen, and you're paying a premium to be protected against something that might happen in the future. For example, home insurance. If you don't have it yourself, I'm sure your parents do. You would not wait until your house burned down to go buy some insurance on it. You would not say, you know, I totaled my car yesterday, I better get some car insurance. No, that's not insurance. But that's what we're talking about on health care. That they will cover pre-existing conditions. If you're already sick, it depends how they define this, they'll have to write insurance for that. Well, what would this cost? A fortune, perhaps? That's the first thing would happen. The second thing would happen, and I've questioned some members of Congress about this in my years covering this stuff, is that if you can buy insurance when you're already sick, why would you buy it when you're well? Would you do that? You would not do that, would you? No, he might, but you wouldn't. You wouldn't.
If I could get away with it.
Yeah, there you go.
Ah,
but no, but you wouldn't.